Hello! Welcome to another post from Dr. Blake's Healing Soul. Today Aphrodite, our athletic trainer here at St. Francis Hospital, will discuss the 4 stages of bunion development.
Okay, so the first stage of bunion development is when you actually look at the foot here, you're going to notice a little bit of a bump over in the joint of the big toe. And in this case, it's very mild and you don't need to worry about it too much. The second stage is when the big toe actually starts to drift over towards the middle toe here. But again, it's not, it's more on the mild side and not, you don't have to worry about it too much. There are various ways you can help it heal without getting to, surgery and things like that. Stage 3 is when the big toe actually comes into contact with the middle toe, and that's when you actually need to start worrying because the forces in the big toe here will cause the bunion to get even bigger and cause the foot as a whole to become more unstable. And stage 4 is when the big toe actually drifts so far to where it goes underneath the middle toe, and the middle toe will kind of overlap the big toe like this, which is a stage where most podiatrists and foot surgeons will actually recommend the patient to go under surgery. So a very basic way to prevent this stage from going to surgery is to use something like a toe separator, and it comes in either foam or gel, or you can use Kinesio Tape, which is in another video of Dr. Blake's, where you actually anchor the big toe here and then pull it on this side to align the toe better. But for the toe separator, you just put it in between the big toe and the middle toe here, and what that'll do is cause the toe to be more in line. And again, that's a very simple way to correct stage 3 and stage 4, which we want to avoid in extreme cases, to align the foot better so that you prevent more problems from occurring in the foot in general.
Great. Thank you very much, Aphrodite, for explaining the very powerful role of toe separators. Hello. Welcome to another post from Dr. Blake's Healing Soul. Today Aphrodite, our athletic trainer here at St. Francis Hospital, will talk about differentiating various causes of pain in the big toe joint.
So a lot of times we have patients that come in complaining of bunion pain, but what we want to do is differentiate between the actual pain coming from the bunion, or if it's a combination of the bunion with something else like hallux limitus, hallux rigidus, if it's something entirely different like sesamoiditis. So the ways to kind of differentiate is when you have a bunion or hallux valgus, you will want to make sure that you assess the range of motion of the patient. So with hallux valgus, the patient will actually not really have a limit in range. They'll be able to dorsiflex their big toe pretty far up, but the pain will actually, they'll complain that it's in the actual bump or inside the joint. And if it's hallux limitus, they will be limited in range of the big toe. So if it's less than 60 degrees of dorsiflexion of the big toe, it's indicative of hallux limitus. If it's less range, it's indicative of hallux rigidus, and that's typically lower than 20 degrees of dorsiflexion of the big toe, so it'll be more down this way. If it's sesamoiditis, they'll typically complain of pain underneath the foot here, but as far as range of motion goes, they'll be able to go pretty far up, which is the same as the hallux valgus. So when the patient comes in with bunion pain and the surgeon wants to go directly to surgery, it's important to assess the actual source of the pain to make sure it's not just coming from the bunion, but that you're also looking at whether it can be a combination of the bunion and the hallux limitus, or a combination of the bunion and hallux rigidus. So make sure that you assess the range of motion, ask them exactly where the pain is, if it's inside the joint or just the bunion, and you just want to prevent doing unnecessary surgery, because you can actually cause the patient more pain if you're not going to the source of the pain before you go the surgery route.
Great. Thank you very much.
You're welcome.
Hello. Welcome to another post from Dr. Blake's Healing Soul. Today, Aphrodite, our athletic trainer, will show how to tape for bunions. It's a very common use of Kinesio Tape.
Okay, so first I'm going to prep the skin by using an alcohol pad, or you can use rubbing alcohol at home. And I just kind of clean the area where the tape is going to be. So in this case, kind of down the side of the foot and then around the toe. And then I'm going to use Kinesio Tape. So normally I'll cut about 3 squares or 2.5 squares. And then I'm going to cut this strip in half.
You can buy 1-inch Kinesio, but 2 inches much easier to find in the store or online.
And then I'm going to cut a little Y strip, so far enough down so that these 2 little strips wrap around the toe. And then I'm going to peel off one of the strips. So you want to take the base of this V here, go on the kind of the base of the toe, wrap around it lightly, just to anchor it. And then I kind of pull the toe slightly out and then just lay the tape on the side. And it's okay if you go slightly on the bottom of the foot too. And I do one more strip for extra support. If you feel like you have enough support with just one, that's fine, just use one. So again, same technique. Base of the toe, wrap around. Pull the toe slightly out and then just lay it down on the side.
The 2 strips should reinforce each other.
And then just rub it to make sure it really sticks. And that's it.
So you can see how patient's toe looks straight now, and this is an amazing way of adding actually a lot more stability to the foot and to the body by stabilizing the big toe joint. Thank you very much, Aphrodite, for explaining that to us. Hello, and welcome to another post from Dr. Blake's Healing Soul. This is Dr. Rich Blake on location in Hawaii. Today I want to talk about conservative treatment for bunions. Bunion pain is a very gradual spreading of the foot, and it is important that in all enclosed shoes you use some form of toe separator. Usually I'll have my patients get medium gel toe separators or large foam toe separators, and that really keeps the toe in good alignment while they're walking. For home, 30 minutes a day of yoga toes or one of their knockoffs is a extremely good way of keeping the tissue loose. If you're very, very tight between the first and second toes, you can try to use a night splint. Foot Smart has probably the best one on the market, but before you ever try to sleep with it, you should try to wear it for 30 minutes and then an hour, then 2 hours during the day when you're reading a book, etc. You should do foot intrinsic exercises like metatarsal doming and single leg balancing to keep your foot as strong as possible, and start looking at abductor hallucis strengthening exercises, which can help get that muscle firing while you are walking. If you tend to pronate, that puts a lot of pressure on the bunion, and it's important to have orthotic devices that shift your weight into the more center of your foot. For those who don't pronate, it's not a vital part of the treatment, and sometimes it's some sports that you do. I have patients that when they run they pronate terribly and really beat up on their bunion, but when they walk they're just fine, and they stay very centered. So it can be a very good part of it. If you're having redness around the bunion, you can definitely do ice massage. You can use just aloe vera and vitamin E creams or softening creams, and 2 or 3 times a day massage that tissue to revitalize it and get rid of the stagnant blood and make it healthier, and that way it's less irritable. And select shoes that are very wide across that area, at least don't have a strap that cuts across it. Get some 1/4 inch adhesive felt from moremedical.com, and that can take pressure. You put it not over the bunion, but just behind the bunion towards the arch, maybe 1 inch square of it, and it will allow you to wear shoes, a lot more shoes that would tend to hit the tissue. Okay, so I hope all these tips are helpful at keeping your bunions stable, less painful, and actually revitalized by getting rid of some of that stagnant blood. Thank you. Hi, this is Dr. Rich Blake from Dr. Blake's Healing Soul. Today is Medical Minute Bunions. It's amazing how many people who have bunions don't wear a simple device called a toe separator. Toe separators are crucial at keeping the joint functioning in its center of axis. The more shoes push the bunion out of place, the more the back pressure pushes the bunion into a bigger and bigger situation. So these are medium gel toe separators that I like, but you can buy rubber and foam ones. There are patients who prefer various ones. There's also toe separators that attach to the second toe, and even toe separators that attach both the first and second toes together. So you can experiment with those. But the medium gel one is a good start. It has a dimple on the top and a flat surface for the bottom of the foot. You place it in all your shoes that you're going to walk with, and that helps, again, neutralize the effect of the shoe. If a shoe cannot tolerate the amount that a toe separator brings, it's probably too tight for you in the first place. So thank you, and I hope this helps your bunion care.